Assalamu alaikum guys, it's Dr. Faraz Ahmad, and today in this video I am going to tell you in detail about transfer letter. Guys, as you know that in past transfer letter used to come in exam for nurses, but last year in 2 or 3 OET exam transfer letter also came for doctors. So I am making this video so you can clear yourself if you have any queries about transfer letter. So in this video I will tell you about writing tips of transfer letter, a structure of transfer letter, and in the end I will also tell you about the parts or template of transfer letter. Okay guys, let me tell you about writing tips of transfer letter. The time is same as in referral letter or discharge letter, that is 45 minutes, and you will have 5 minutes to read the case note and 40 minutes to write the letter from case notes. Okay, always use 2B pencil while you are writing any type of letter. Write letter between 180 to 200 words. You can exceed about 15 words. Okay guys, always try to use template while writing any type of letter, either transfer letter, either discharge letter or referral letter. While you are using template in writing, you will commit minimum mistakes. Okay, so always try to use template. Always practice on official answer sheet so that you can feel a minimum difficulty in exam. Okay, try to finish your letter in 35 minutes and rest of the 5 minutes so that you can look for any mistakes. Okay guys, read the corrected letter from any source. You can read corrected letter from benchmark, from any other source, or you can visit my Facebook group OET by Dr. Faraz Ahmad, where we evaluate letters on weekly basis. You can also read corrected letters from this group as well. Okay, include only the relevant information in the letter, exclude irrelevant information from letter. Always leave a space between the paragraph, and any paragraph should contain more than 2 sentences. Some of the people write only 1 sentence in whole paragraph, but it looks not good. Okay, so try to write minimum 2 sentences in a paragraph. Avoid very long sentences. Keep in mind that while you elongate any sentence, there are maximum chances of mistake. Okay, so avoid very long sentences. Use of punctuation and use of singular and plural form and use of correct articles is very important while you are writing any type of letter, either discharge, referral or transfer letter. In every new paragraph, use patient name once in start, then use pronouns. Okay, there are many students, many of the doctors who use pronouns in start of every paragraph. Like people say that he presented to me with the complaints of. Don't use pronoun in start of any paragraph. Mr. Jones presented to me with the complaint of dash dash dash. Then you can use pronoun. Always use patient name in start of every paragraph and then use pronouns. Okay guys? Okay, so let me tell you about the format of transfer letter. So here I will tell you in detail that how to compile a transfer letter. So first of all, you have to mention address. This is same as discharge or referral letter. Then you will mention introductory paragraph, and then you will start body of letter. In the first paragraph of body of letter, you will write about social, family, past medical history, allergic history that is relevant to the diagnosis of patient in given case note. Always keep in mind that you have to include social, family, past medical and allergic history that is relevant to the diagnosis given in case note. Don't include everything given in the case note. Always include relevant information. Okay, in the second paragraph of body of letter, you will have to include hospitalization, including chief complaint, any procedure, recovery status and the current status of patient. Okay, so all of this these information you will include in second paragraph of body of letter. In third paragraph of body of transfer letter, you will include transfer plan, treatment, any advice given and medication given to the patient. Then you will include a conclusive paragraph. At the end you will write salutation. Okay, so this is the format which you have to follow while you are writing any transfer letter. Let me tell you one by one that how you will write address, how you will write introduction, how you will write body, conclusion and salutation of transfer letter. First of all, in address you will write date, then you will write the name of doctor, Dr. Faraz Ahmad, future endocrinologist, DHQ Hospital, Mianwali. So you will write any name of doctor in this way. Okay, if doctor name is not given in case note, then you will write admitting officer. Okay, then you will write admitting officer, DHQ Hospital, Mianwali. Okay, after writing date and name of doctor, then you will leave a space and you will write dear Dr. Ahmad. Okay, you will write dear Dr. Ahmad. But if no name of doctor is given, then you will write here admitting officer, and here you will write dear sir or madam, dear sir / madam. Okay, then you will leave a space and you will write reference of patient. You will write RE and then you will write Mr. Barry Jones, comma, date of birth in this way. You can also write reference in this way as well, that reference Mr. Barry Jones in the next line, date of birth. Okay, you can write in this way as well, reference Mr. Barry Jones, comma, aged 27 years. So in 3 ways you can use any of the way while you are going to write reference of the patient. Okay guys, now let's move to the introductory paragraph. First of all, let me tell you that introductory paragraph must include where the patient is going to be transferred and what is the reason of transfer. Where patient is going to be transferred and what is the reason of transfer. So keeping in mind these two information, where you are going to refer the patient and what is the reason of referral, then you will write an introductory paragraph. Guys, keep in mind that transfer letter is a type of discharge letter. So you will update the doctor receiving the patient. Okay, so you will update him. So you will write introductory paragraph in this way. I am writing to update regarding Mr. Luke, a 30-year-old accountant who is being transferred today to intensive care unit because his meningitis has worsened in recent days. Okay, so where you are transferring the patient? To intensive care unit. Why you are transferring him? Because his meningitis has worsened in recent days. Your further care would be greatly appreciated. Okay, you can write in this way as well. So guys, this introductory paragraph was between the department. You was transferring the patient from medical department to intensive care unit. Okay, and this introduction is from one hospital to other hospital, or from one setup, from surgical setup to rehab setup. So you will write in this way. I am writing to update you regarding Mr. McDonald, a 68-year-old male who is being transferred today to rehabilitation after left total knee replacement. Your ongoing care would be greatly appreciated. So you are transferring where? You are transferring to rehabilitation center. Why you are transferring? Because patient underwent total knee replacement surgery. So you are now transferring him for any rehabilitation management if he needs. Okay. Okay guys, after introductory paragraph, let's move to the body of letter. So you will write body of letter in 3 parts. In very first paragraph of body of letter, that is immediately after introductory paragraph, you will write social, family, past medical and allergic history. So always mention family, past, social or allergic history that is relevant to the diagnosis of patient given in case note. Okay, so you can write this paragraph in this way. Mr. Jones is single. She has had heart problems since 2005, for which she takes beta blockers. His family history is positive for asthma or diabetes or any other illness. Please note he is allergic to penicillin. You can also write in this way: Mr. Jones is widowed man and has 2 children. He has a medical history of dash, and please note he is allergic to dash. So keeping in mind the diagnosis given in case note, you can write this paragraph according to the diagnosis given in case notes. Okay, you can also write in this way as well. Okay, Mr. Jones is married and has 3 children. His medical history revealed that he has a long history of dash, diabetes mellitus or hypertension or any other disease for which he has been taking dash medication. It is worth mentioning that he is allergic to penicillin. So while you are going to mention any allergy, you should write, please note he is allergic to penicillin or any other medication. Or you can also write, it is worth mentioning that he is allergic to penicillin. Okay guys, after mentioning this history, we will move to the second paragraph of body of letter, which will include hospitalization, including chief complaint of patient, the complaint which brought the patient to the hospital, any procedure done in the hospital, a recovery status of the patient, and you can also mention in this paragraph about the current status of patient. Okay guys, but keep in mind current status of patient can be mentioned in this paragraph or in the next paragraph as well, depending upon the condition given in the case note. Okay, so we will write on 20th 7 2018 Mr. McDonald was admitted in the hospital for surgery. So we have mentioned about surgery in introductory paragraph, that was total knee replacement surgery. Okay, after surgery his pain was managed with ketamine and amitriptyline. His CSU showed the staph seprolyticus, due to which Keflex was commenced along with the post-op antibiotics. So this is the second paragraph in the body of letter. Here we have mentioned about the presenting complaint, patient came for surgery, and about the procedure what we have done total knee replacement therapy, and after surgery what we have done, we have managed the pain with ketamine and amitriptyline. Then we have also mentioned about the ongoing status and about the hospital status of patient in this paragraph as well. Okay, so in the next paragraph we will mention about current status, transfer plan, treatment, advice or medication to the patient. Okay, so we can write current status in previous paragraph or in this paragraph as well, depending upon the conditions given in case notes. So now we will write, now Mr. McDonald is stable. Mr. McDonald's condition is improved now and ready to be transferred into your care for physiotherapy and home visits for occupational therapy. Okay, so in this way we have mentioned about the current status of patient, current condition is he is improved now, and transfer plan, what is our plan? So ready to be transferred into your care for physiotherapy and home visit for occupational therapy. Additionally, so we will also mention treatment, advice or medication given to the patient. Additionally, his discharge medications includes Zyloric and Lipitor in addition to painkillers. So in this way we will conclude, we will write about the current status and the transfer plan and medication given to the patient in the third paragraph of body of letter. Okay guys, after concluding the body of letter, we will move to the conclusive paragraph of transfer letter. So conclusion is almost same about referral letter. In light of the above, it would be greatly appreciated if you could see Mr. McDonald's for rehabilitation session. So conclusion is same as referral letter. Then we will write, should there be any queries, please do not hesitate to contact me. And keep in mind that these lines, should there be any queries, please do not hesitate to contact me, not counted in words count. Okay guys, so in this way, this is very easy template for writing a transfer letter. You will write using this template, you will write transfer letter and you can score very good grades in your exam while you are writing a transfer letter. So then at the end salutation we will write yours sincerely, we will leave a space and doctor. Please do not forget to put a full stop after doctor. If you start the letter with dear sir or madam, if doctor's name is not given in the case note, then we will write dear sir or madam. Then instead of yours sincerely, try to use yours faithfully. Then leave a space and mention doctor and put a full stop here as well. So guys, that's all about today's video about transfer letter, and I think this is very easy template for transfer letter. Please use this letter, and inshallah in upcoming weeks we will upload a transfer letter case note in our Facebook group, and so that you can write a transfer letter to practice. Okay, so you can write a transfer letter to practice this template. Okay guys, keep practicing and keep praying for us. Thank you very much. Allah Hafiz.